My name is Badru Ssekitooleko from Uganda. I was recommended to come to India and do a specialized training under Merck Foundation Africa Oncology Fellowship Program by the Ministry of Health, and I'm carrying it out from KVV University. The key challenges in Uganda in oncology are quite diverse, ranging from human resource, diagnostics, and then the treatment. Especially in my field, specifically the field of uro-oncology, we've not been having a uro-oncologist in Uganda, so I'm lucky that I'll be the first uro-oncologist in the country. We are a number of urologists back home, but someone specifically trained to manage genitourinary cancers, at least we've been missing that. Despite the huge number of patients that we do have. The oncologist is doing the medical treatment, those we have in plenty, the radiotherapists, yes, they are there. But the component of surgery, that's where we've been missing, and we hope now that gap has been bridged. So the areas in uro-oncology that need improvement, one is human resource, because for any country or any institution, it is human resource first, which is the most important. Then these other things, diagnostics and the medicines, yes, they're also very important. But human resource training, human resources, I think it's the most important and the core of any healthy related field. So the challenges that we've been having in uro-oncology, I think that has been solved, because I guess we are going to be having a uro-oncologist who now has to take on the mantle and train as many other uro-oncologists in the country as possible. The field of uro-oncology is been a bit green in our country, but we hope that when I go back, then I'll have the necessary support to be able to apply the skills that I've acquired, then help our patients better, then still also teach my colleagues and those who would be interested in uro-oncology. We already have some of our colleagues who are so passionate with cancers of the genitourinary system. So I hope that when I go back and I team up with them, then we shall be able to help our patients better with that team. My expectations that I had before I chose to do uro-oncology and what I've acquired was to upgrade and improve on my knowledge and the skills that I already had. We were doing back home part of oncology, of uro-oncology, but I would say, yeah, there is a lot that was missing. So I wanted my laparoscopic skills to improve. I wanted my knowledge and my skills of how to manage these cancers using the current guidelines and basing on the current guidelines. So, and I'm happy I've been able to acquire all of that. So my expectations have surely been fully met. I can say that with confidence. The other areas of exposure, apart from the transplant and the uro-oncology areas, on the medical side, we've been also able to rotate through medical oncology, and we've also been able to understand how our fellow medical oncologists do manage these cancers using drugs, but not the knife. I've also been able to rotate through the radiotherapy units, and how to see how these cancers are managed, the prostate cancer, penile cancers, kidney cancers, tumors of the testes, tumors of the bladder, how they are managed using radiotherapy. So the knowledge that I've acquired, given that I'll be in the National Referral Hospital, where we are having, which is a teaching hospital, and we are having all sorts of patients. So this knowledge will not go to waste. We shall transfer it to our colleagues. Then we shall also transfer this same knowledge to our patients, in other words, by managing them, operating on them, advising them, and also maybe advocacy wherever possible, such that we can have advocacy in terms of human resource and advocacy for better patient care, especially for the things that we've seen here that are possible, that can be done, and with our resources we can try also to advocate and see that our patients are able to get some of these good services. So the new aspirants of the training of uro-oncology, it is very important that before you come to India or any other place, it is important that you've understood at least the basics. When you come to these countries and you had good basic urological training, it becomes simple for you to work with these colleagues and the teachers to teach you. It becomes very hard if you are green, you've not been operating, you've not seen these cancers before. Teaching becomes a little bit hard. So my advice would be that before someone comes, you at least work with a senior in your country, then it teaches you these basic skills before you come back here, you come this side. Then it is very important to thank Merck Foundation for the support, for the training, and the care they've given us throughout this entire training. Surely if it wasn't for that extra mile that Merck Foundation has done, maybe it would have been a little bit hard for Uganda to have a dedicated, well-trained uro-oncologist. So a big thank you to Merck Foundation, to Senator Dr. Rasha, and the head of the Asian side of Merck Foundation, that is Mr. Venu, and his team. I thank them dearly for giving us this opportunity. Then I also want to thank this hosting university, KVV, Kim's University. It's been extremely responsible. It has made sure that we not only get the uro-oncology skills, the transplant skills, and these other advanced urological skills, but they made sure that we are comfortable. We are staying well, and they provided very good meals and everything good to us. So a big thank you to the Honorable Chancellor, Professor Suresh, and his management and assistant, and the Deputy Director, Chana Madam, and the whole team of Kim's University. Thank you so much. Then I would also like to thank our Minister of Health, because it was through them that I was able to come this side, because they recommended me to come to India. They recommended me to get sponsorship through Merck Foundation and come here. Otherwise, it would be extremely very hard for me to be here. So I'm also still actually expected, when I'm done, to go back to my ministry, and I tell them, wherever you sent me, I'm back, so you can deploy me wherever you want. So I'm very grateful to the Director General, who actually signed, Dr. Mwebesa Henry, and the Permanent Secretary, who gave me a study leave, Dr. Twine Diana, and the Minister of Health, Dr. Acheng Ruth. Thank you very much. Uganda.